Hi, my name is Christine Walsh, and I'm going to be presenting my validation for the setting up of a medication through an IV. So the first thing I'm going to do is make sure I have my physician's orders. The next thing I'm going to do is go into my patient's room, introduce myself to the patient, and verify that they are the patient by either checking their wristband or asking them for two forms of identification if they can speak. I'm also going to be assessing the area of injection just to make sure there's no signs of infection. I'm also going to be asking the patient if they have any discomfort or pain. I'm also going to be explaining the procedure to the patient. Once I've done all of this, I'm going to provide for privacy, wash my hands, and begin with the procedure. So I've washed my hands, I've gathered all my equipment, which is a basin, of course the IV, the tubing for the medication, the actual medication, alcohol swabs, and gloves. So I'm going to put a pair of gloves on to make sure to just have another line of protection against me, for me.
Oh no. I forgot to add tape to that.
I'm going to check the expiration date of the medication. Once I've done that, I'm going to take a label. I'm going to put this on the medication bag with the date of expiration, my initials, and the date and time that this medication is being set up, because some medications can and can't last for a certain amount of time once they are used. So this is labeled and ready to go. The next thing I'm going to do is open up my bag of medication tubing. Alright. So I have my hook for my bag of saline, and I also have my IV tubing, my medication tubing. So I'm going to take this wrapping off. Okay. I'm going to unravel the tubing. I'm going to put a label on the tubing with my initials, the date and time that this was set up, and the expiration date of the tubing, just so people know when it's time to be changed. So everything is labeled. I'm going to hold this end. I'm going to take the top off of the needle of the tubing. Okay. The next thing I am going to do is I'm going to take the cap off the medication. Okay, I'm going to slide that down there. And I'm going to spike my medication bag. Also making sure that my clamp is completely closed so that no medication can flow through. The next thing I'm going to do is I'm going to set this up. I'm going to put my bag on the hook. I'm just going to hold this end here. I'm going to prime it. I'm going to fill it up about halfway or 2/3 full. Alright, so we're about halfway, 2/3 there. I'm also then going to unclamp my bag, and I'm going to take this little part off just to make sure so that there's no airbags in the tubing.
I will make sure everything still has
Okay.
the capsule to make it sterile. I'm going to spike my bag.
Okay, so there are no air bubbles in the tubing right now, so I'm going to reclamp this. I'm just going to hold the end of my medication tubing right over here in my hand. I'm going to put that cap down there. I'm also going to, before I attach this to my saline, I'm also going to make sure that my bag of saline is below my medication so that the medication can get a better flow into the line. Okay, so that's hung. The next thing I'm going to do is I'm going to attach the medication to the IV line. I'm going to unscrew this, making sure, of course, before I do anything, all of my clamps are set so that my so that none of the medication or fluid freely flows all over. Excuse me. All right. Again, this is also the side that would be going into the patient, so I wouldn't really be holding this. So I'm going to get this into the line. I'm going to make sure that my entire tubing is in the eyesight of me so that I don't make any mistakes. Making sure all of my clamps are set. So I have my port here on the main line ready to go. The next thing I'm going to do is just kind of wipe it down with an alcohol swab to make sure that it is clean for the medication. Okay. Wiping it down for about 15 seconds.
Check to make sure there are no air bubbles, and there are no air bubbles right now. So I'm gonna completely.
Okay, so that's clean. Okay, and I'm going to screw this on. Attaching the medication to the main
I'm also going to
line going into the patient. So this is attached. I'm going to open up my clamp of the medication.
Now I'm going to assess the patient's IV
Okay.
port to make sure there's no tenderness. And
So this is set, ready to go.
prior to that, I am going to
The last step that I have to do
clean
is
the area.
take, again, this would be going into the patient. I'm going to undo my clamp on the main line.
My equipment's going to consist of one 250 ml.
Okay, all my clamps are undone. I am going to also calculate drops per minute, and I'm going to be looking at this
Time flow sheet.
right over here. I'm going to take off my cap.
An IV set change
Okay,
from alcohol pads if needed.
so that's dripping right there,
Begin.
and I'm going to try to get
Back there.
And then
about 10 drops per 15 seconds, so it's about 40 drops per minute.
per minute, so then the drop should be 1 drop per second.
Now close the shot of the roller clamp.
Okay, so now I have made it, so that is 1 drop per second.
Now make sure
Should
it's
be
all
15 drops per 15 minutes, seconds, excuse me. Then I'm gonna make sure the patient is comfortable, and at the lowest level, I'm gonna put the call bell button, make sure the patient is good to go. I am going to record my I and O's, wash my hands, and I'm all done. Thank you.
So that worked out really well. Okay. We did IVs now. I'm just gonna write. I forgot to leave something back, but.
Do I do those?
No way. 13. I wish I got it in real life, cause it literally finished, and I was like, oh.
I'm doing my video validation on setting up an IV. Start off. We're gonna
Okay, so piggy.
identify the patient. Position.
So I've gotten my 10 drops per 15 seconds. So I'm going to clamp this.
40 is better.
So in reality, I wouldn't clamp my tubing again, but for purposes of the video, I don't want to have this running all over. So this would be set. This would be in the patient by now. I would assess, make sure that they are okay, and I would put.
What if we do an easy number?
I'm just going to set this here so that I can finish the procedure. Again, this would be in the patient. I'm going to just put the cap back on here. So the next thing I would do is I would make sure that the patient was okay, that they were comfortable. I'm going to put the rail of the bed back up. I'm going to place my call light next to the patient. Once all of this is done, I'm going to clean up my equipment, take my gloves off, wash my hands, and report back to the physician and write it on the chart that I have taken care of the patient.